I think the university has done a good job of controlling the pieces that it can. I think it, when issues pop up on campus relating to COVID, I think it's going to be a lot more to do with the way students and our community interacts outside of the classroom and outside of kind of campus events.
I do not think Pitt's plan will be effective, and I think it's already been proven that it won't be effective. Even if 95% of people are following protocol, I think we still risk a massive outbreak with the current plan that's in place. I think it's only a matter of time before more people test positive, especially the more people you bring on campus, even with certain safety protocols in place. I think people who say, if you're going to open up campus, you have to be comfortable with students dying. I think people are afraid to phrase it like that because it comes across as extreme, but that's not an extreme. Like, that is what is going to happen.
I feel like to some extent, it's inevitable. There'll be a rise in cases with so many students coming from so many different places, all in like a pretty dense area. But I think like working with that, I think the school's guidelines will be effective enough to help limit the number and not let it get out of control like it probably would be if there were no guidelines in place.
You're going to have potentially a lot of cases, and you're going to, when there are positive tests at Pitt, which there will be, you're going to rely on contact tracing, isolation, and these types of things. And I think once we see the first few cases on campus, we'll see that things will go on as people test positive.
A lot of us haven't been tested. Like I haven't been tested. So I feel like there's going to be a lot of people who are asymptomatic in our age group who didn't realize they had it, and the tests are going to come back positive, and there's going to be a lot higher number. Like the numbers are all going to be way higher than they're expecting, and then they're going to get scared and send us home.
We know for sure some sort of spike is coming back up. Like with all these college campuses opening back up, that's going to happen. It's whether is it a big outbreak and will the curve stay flat. People really need to understand that they need to take these necessary steps to prevent the spread of a pandemic, and it's not a trend.
I hate phrasing it as like, I don't trust people, but I don't trust people. People make dumb decisions all the time, which generally is fine. But when it's a public health issue, that's not okay.
With any community, you're not going to get 100%, but I'd like to think that your average Pitt student is more willing and more open-minded to accept the changes and adapt to this new environment we're working with.
One, I need to know whether I need to come back to Pittsburgh in quarantine or not, period. Again, coming from the #1 hotspot in the world for coronavirus right now, I'm not putting my students' lives at risk if I haven't quarantined for 2 weeks. I think teaching, I need to know whether I'm teaching in person or online. That just affects how I teach things and how I prepare for the semester. And I also need to know what I need to be doing now to prepare for the inevitable health and safety risk that me and my students will be placed at. I think some of these questions, we need more concrete answers from the administration regarding these things. If I have a say in whether I teach in person or not, I would like to know that now. They haven't told graduate students whether that's the case or not.
We faculty are in the same position as students with respect to information, and that information is not, it's not an optimal flow of information on one hand, but also in terms of participation. I don't think there's been as much effort as there could be to bring faculty and student voices together to talk about this plan.
I just don't really feel like I understand what the plan is besides wear masks and social distance and limit classroom capacity. That just all seems like common sense stuff. That doesn't really seem like a plan to me.
The school needs to hear what the people think, and throughout this entire current planning process, as well as during the year. So we are after all the people that are going to be affected by these policies the most.
There needs to be more consideration of some of the challenges that arise for faculty who have young children. I mean, I don't think in any of the announcements I've seen from the university at all, there's been any mention of parental responsibilities. like literally none. And I think that's a problem.
Students who I'm sure are equally as concerned with us and maybe are unsure of what the future holds for us, I would definitely let the school know, and whether that's through email or phone call or whatever, I would definitely voice your concerns to the school. I don't know how much they'll listen, but if you truly have concerns and want them to be heard, I wouldn't sit quietly. I would let the school know and make sure your opinion is expressed to the school openly.
The university really needs to, I think, get its message out in a way that's a little bit more precise, clear, and in a lot of ways, just make sure that you get the message out to people in a way that doesn't make you look bad.
Point blank, I do not think it's safe to open campus in the fall. I do not think it is. I think you can put in as many policies in place. You can give 2 masks to every student. You can do that. That will help. But at the end of the day, students are going to get sick, and students and faculty are going to get sick, and students and faculty are going to die.